up on pregnancy. So today's video I'll be mainly focusing upon the Caesarean section. And this video is mainly focusing upon that when do the gynaecs or the gynecologists they suggest to go for Caesarean section. So in this video we'll be mainly discussing and focusing as to what is the definition of Caesarean section, what are the types of Caesarean section, and what are the indications of it. So beginning with, you must have heard that Caesarean section, it is nowadays a very common procedure what is being done in most of the hospitals where the vaginal delivery is at risk, where either the fetus or the pregnant mother is having certain kind of complication, is having certain kind of a risk factor. Doctors, they mostly go for a safer measure, safer side, they prescribe, they suggest for Caesarean section. So beginning with the definition of Caesarean section, it is a surgical technique to abdominally deliver the fetus by systematic incision. So Caesarean section, it is a surgical technique, that is, there is a surgery, there is this incision is going to be given, and those incisions are done where the abdominally, it is given on the abdomen to deliver the fetus by systematic incisions through the maternal abdomen and the uterus. So, it is a surgical technique to abdominally deliver the fetus by systematic incisions through maternal abdomen and uterus, performed mainly to reduce the risk that the mother or fetus may incur during the course of vaginal delivery. So there are certain risks, there are certain complications, there can be certain complications which the doctors know beforehand that this certain things might happen. So the doctors mostly they suggest that the individual, the pregnant mother should go for a Caesarean section wherever there is certain kind of unavoidable circumstances, or there is risk to the mother or the fetus that may incur during the course of vaginal delivery. So vaginal delivery in a general term, it is also called as the normal delivery. So when looking at the types of Caesarean section, so we look at that there are two types of Caesarean section what is being performed. One is the lower segment Caesarean section, which is also called as the LSCS. The other, it is the classical Caesarean section, which is called as the CCS. So in the lower segment Caesarean section, the incision is given in the lower abdomen, just in close vicinity to the urethral, the urinary bladder. It is given, the incision is given close to the urinary bladder, and this kind of a lower segment Caesarean section, it is having a lesser blood loss, and it is also having lesser post-operative complications. So it has got an excellent healing, it has got least post-operative complications. So this is the lower segment Caesarean section which is mostly preferred. Apart from this, the classical Caesarean section is a type of Caesarean section where a vertical incision is given in the abdomen, and it is the abdomen is given a vertical incision, and once the abdomen is opened, the vertical incision is given in the uterus as well to deliver the baby. So these are the two types of Caesarean sections what is being performed. And when looking at the indications, so the indications of the Caesarean section can be broadly subdivided into three categories. First is the fetal indications, the next is the maternal indications, and the last it is the emergency section. Now when looking at the in fetal indications, so there might be certain attributable risks which can occur during the course of vaginal delivery. So doctors, they suggest what are the fetal indications we'll be one by one looking at. So beginning with, first it is the fetal distress. Now, fetal distress can be understood as a situation where your baby is not well. In other words, most of the time, it is seen that the baby is going to receive the oxygen, the nutrient supply through the placenta. So once the baby is not having appropriate amount of oxygen supply, so there is a possibility that the fetus is in distress. So The first condition is fetal distress, which can be very easily diagnosed, and mostly this fetal distress situation occurs during labor pains. So it is found that the fetus is not receiving adequate amount of oxygen, and so it can be said that during the times of labor, this fetal distress is very common. And the other factors in how fetal distress is manifested. So most of the times uh, it is seen in the form of certain symptoms. So the first symptom, what it is there, that the fetus is have depicting some abnormal heart sounds. So that what is the normal range of a fetus heartbeat? So the fetus heartbeats it is somewhat abnormal. It is either slower or faster than the normal range. The next important point in fetal distress, what we need to understand is that there is decreased movements of the fetus. Apart from this, there can be meconium in the amniotic fluid. So this is again a symptom of fetal distress. The pregnant mother can feel cramps in the abdomen. So again, this can be suspected to be a sign of fetal distress. Apart from this, there can be vaginal bleeding, as well as there is an in obese women, and when there is an abnormal weight gain. So it is in such situations also, when the maternal weight gain is too much, so in such situations also this situation of fetal distress is seen. Moving on to the next important fetal indication is cord prolapse. So cord prolapse, it is a condition where the umbilical cord is going to descend down into the cervix, or it can pass beyond the fetus. So it is this cord prolapse, it is the descent of the umbilical cord near to the cervix region, and near to the cervix region where it is there, it is called as an occult type, whereas the other type, it is the overt type. So this kind of a cord prolapse situation occurs when the water breakage is there without the induction of labor pains. So that is, this cord prolapse is mostly seen in the cases of premature rupture of membranes. So whenever there is a premature rupture of membranes, the water breakage is there, and since the water breakage is there without the labor pains, the situation of cord prolapse occurs. So in such a situation, the doctors mostly advise that it is a very threatening situation, so they suggest for Caesarian section. Moving on to the next important condition, that there can be fetal bleeding. So at times it has been found in cases of placenta previa, in cases of placenta abruptia. So in such situations where there is fetal bleeding, where the umbilical cord is attached to the placenta, at that particular site, if this certain kind of a bleeding is going to occur, so it also suggests that it is some kind of a threatening or a dangerous situation. So in cases of fetal bleeding, which is also called as the vasa previa, in such situations also doctors, they suggest for this Caesarian section. Moving on to the next important condition, which is called as the macrosomia. So what is macrosomia? Macrosomia is an increase in the size of the fetus body size usually above than the what is the normal size. So in macrosomia, the body parts of a developing fetus gains too much size due to certain kind of factors such as gestational diabetes. So this gestational diabetes video I have already discussed. You can go to my link in the previous videos, and you can find that video of gestational diabetes. So in situations of gestational diabetes, the body parts of the fetus is usually more than the normal size. So in such a situation, the vaginal delivery is going to create a problem. It's just going to is a threat. So in such situations, the doctors, they suggest for Caesarian section. Moving on to the next important condition, that in cases of multiple pregnancies, so those mothers who are having twins or triplets, so in such situations where the multiple pregnancies are there, the twins are there, so that also is you can say it is the alarming thing. So in order to have a safer side, the doctors, they prescribe Caesarian section. Apart from this, if the mother is suffering from maternal herpes genitalicis infection, this also necessitates the Caesarian section so that the infection would not spread to the newborn. And apart from this, abnormal presentation. So if the position of the fetus in the uterus is being found to be in certain kind of, if it is a bow shaped or transverse or oblique lie, or if it is a breech. So in such abnormal presentations, the doctors suggest that they should go for Caesarean section. Apart from this, there are certain maternal indications as well. So in cases of maternal indications, what we can understand is that there can be gross pelvic contractions. So if it is a gross, in case of a gross pelvic contraction, again the doctors will suggest for Caesarean section. If it is a uterine rupture, next is the eclampsia and the fulminating preeclampsia. So preeclampsia, it is a persistent increase in blood pressure after 20 weeks of gestation. If the mother is hypertensive and the blood pressure is persistently increased after 20 weeks of gestation, the condition is called as the preeclampsia condition. And eclampsia, it is the seizures, what occurs as a complication of the preeclampsia. So it is the eclampsia and the conditions of eclampsia and fulminating preeclampsia. The doctors, they suggest for Caesarean section, and mostly it is found that in mothers who had previous given birth to babies through previous Caesarean section. So that is also one of the indication. Next is the in cases of cervical cancer. So when it is the cancer of the cervix as well, the previous urinary incontinence surgery is there. So if the female has undergone urinary incontinence surgery, so that also is one of the indication for maternal indication for Caesarean section. Next is the associated maternal medical illness. So medical illnesses such as severe hypertension, cerebral aneurysms, severe cardiac illness and diabetes, they are the maternal indications what the doctors are going to suggest for Caesarean section. Apart from this, there can be pelvic space occupying lesions such as the ovarian tumors, the low-lying uterine fibroids if it is there. So that also is a clear indication for Caesarean section in order to prevent the potential risks. Apart from this, if this is the maternal preferences, so there are certain women, certain pregnant women, they want a safer delivery of their baby. They don't want to bear that excessive pain during vaginal, that discomfort what is there. So mostly there are certain maternal preferences as well for Caesarean section. Apart from this, the last but not the least, that is the HIV positive mothers, where the Caesarean section is very important in order to prevent the HIV transmission from the mother to the infant. Now moving on to the emergency situations. So emergency sections, when is the emergency section? I've already discussed about the cord prolapse. So cord prolapse, it is the descent of the umbilical cord through this cervix or pass through it due to premature rupture of membranes and water breakage before, if it is not accompanied by labor pains. Apart from this, if it is the case of non-progress of labor, if the labor pains are not going to progress, then also doctors, they go for an emergency Caesarean section. Apart from this, in cases of fetal distress, I have already discussed antepartum hemorrhage. So antepartum hemorrhage is a condition where after 24 weeks of gestation, through the birth canal, there is some kind of a bleeding. So this is called as the antepartum hemorrhage. In such situations, also the emergency Caesarean section is being carried out. Apart from this, next is the discordant or the larger second twin. So in case if there's a multiple pregnancy and twins are there, one of the twin is larger in size, one of the smaller in size. So that is again a potential risk threat for the pregnant mother as well as the fetus. So doctors, they say if it is a discordant or the larger second twin is there, that is also a necessitates for the emergency Caesarean section. Apart from this, the cephalopelvic disproportion in labor. So what is the cephalopelvic? We can split the word into two parts, but one is the cephalo and next is the pelvic. Sometimes the size of there is a mismatch between the size of the head of the fetus and the birth canal through which, and the vaginal or the birth canal, the size of the birth canal, there is a mismatch between the size of the head of the fetus and the birth canal. So if it is a disproportion in the cephalopelvic region during labor, doctors, they go for emergency Caesarean section. The next is the deep transverse arrest. So deep transverse arrest, it is a condition where what we find is that the fetus is lying in a transverse position and it is unable to neither rotate its head nor descend down. So it is mostly seen in cases of when the fetus is arrested in a transverse state, and that too its head and its upper and its body part is unable to, the head is either unable to rotate and the body is unable to descend down, and it is mostly stuck in the ischial vertebrae at the level or above the level of the ischial vertebrae. It is unable to descend down. So this is a deep transverse arrest, and mostly in this deep transverse arrest, the normal uterine contractions are there, the normal birth canal size is there, the more normal, the cervix opening is normal, the labor pains are normal, but due to the transverse position of the fetus and the inability of the head of the fetus to rotate and descend down, so this also necessitates for an emergency cesarean section. And last but not the least, that is threatened or scarred dehiscence of the previous cesarean section. So sometimes during mothers who have been having multiple pregnancies, and in the previous pregnancies what they've had that they had their delivery via cesarean section, and if the delivery is via the cesarean section, so all of a sudden what happens is that the scar dehiscence occur. So whatever the previous cesarean section scar, if it is present and if it starts rupturing, if the scar dehisces, if the scar disintegrates or it dehisces, it opens up. So in cases of scar dehiscence of previous cesarean section or threatened scar dehiscence, it is there, so again the doctor will go for an emergency cesarean section. So students and viewers, this was a very short discussion where I tried my level best for you to simplify what are the indications and when do the gynecologists they are suggesting the pregnant women for a cesarean section, and what are the situations what is making the cesarean section mandatory for the pregnant women. So students and viewer, if you are new to this channel, if you haven't subscribed, subscribe. And if you like this video, give this video a thumbs up and don't forget to share amongst your friends. And if you want such videos, there are certain queries or comments, you're most welcome to comment me in the comment section. And don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.